spreads to the occipital lobe. If the wave spreads to the occipital lobe, where you have got your visual cortex, what is going to happen over here? Patient is going to have zigzag lights. Okay, I mean, he can see zigzag flashes of lights. Next, he can also see flashing lights, zigzag lights, flashing lights. And third important thing is that patient can also visualize the blind spots. Okay, so three important things. Now, out of all this, guys, most of the patients with visual aura, they complain of blind spots. Blind spots is a classic visual aura. Okay, blind spot is a classic visual aura. Now, after this blind spots and all, the next important thing we have to discuss is that what happens if it goes to the sensory cortex? Occipital is done. What happens if it goes to the sensory cortex? What goes to the sensory cortex? The abnormal current, right? The abnormal electrical activity. If it goes to the sensory cortex, then patient is going to have tingling and numbness. Tingling and numbness, both of them are same. Okay. Again, I don't want to write here. Just remember, if it goes to your temporal lobe, where the speech area is present, your Wernicke's and your Broca's area, then patient will have difficulty in the speech as well. Okay. Now, the most important thing I'm going to tell you, what is that? You have to know the differences between, most of them they get confused over here, guys. Okay. Why do they confuse is that they don't understand what is the difference between migraine and they mix up with tension type headache. Okay, this is tension type headache. So you have to clear cutly know the differences between your migraine as well as tension type headache. First important difference is what is the quality. If you look at the quality of headache, okay, if you look at the quality of headache in case of migraine headache is throbbing or pulsatile. This is how the pulsatile nature of the headache feels. Okay, so migraine headache is, why it is pulsatile or throbbing? What did I tell you in the starting? This is a problem of the neurovascular bundle, right? So it is a neurovascular headache. So in the neurovascular headache, nerves will be affected like trigeminal nervous system, and vessels also will be affected like the throbbing headache and all. So patient is going to have throbbing or pulsatile headache. But whereas tension type headache, why tension type headache happens? The word itself says tension. So whenever you are tensed, okay, not because of your exams or your personal issues, whenever you are tensed, in the sense, let us say there is neck muscle spasm, if you are sitting in a same direction for a longer time, working in front of the computer, right, or operating on a patient for many hours or continuous cases in a day. So in this condition, what will happen? Your neck muscles will undergo spasm, they'll become tight. Okay, so that is when the patient will develop tension type headache. It is not because of the blood vessels, but it is rather because of the band, the fascia, the muscles on the neck and head. When they are contracted, then the patient is going to have this tension type headache. So this is not pulsatile, but this is a dull type of headache. It is dull and it is associated with pressure. It feels like a tight band. Have you anytime felt a headache all the way from the frontal region till the occipital region? Because from the occipital till the frontal, you have got a band, fronto-occipital band that contracts, leading to this particular headache. Now the second important thing is, quality के बाद discuss करना है intensity. What is the intensity of this particular headache over here? Okay. If you look at the intensity, guys, intensity over here is moderate to severe intensity, whereas in a tension type headache, you will find mild, very mild, mild to moderate. If you look at the location, which is very, very, very important, most of the times, the headache which you have in migraine is unilateral. So you will have the pain in the eye and all the way this one, all the way this side, okay, unilateral. Okay, I'm not telling in all the patients you will have unilateral. Even in some migraine patients, I've